Well, welcome to everyone. Welcome to our dignitaries first. I wanted to say welcome and thank you to the Moose Jaw Lake Centre Member of Parliament, the Honourable Mr. Fraser Tolmie. Welcome to the Moose Jaw Waccamaw Member of the Legislative Assembly, Mr. Greg Lawrence. Welcome to the Moose Jaw Mayor, His Worship, Mr. Clive Tolley. Welcome to the Moose Jaw Chief of Police, Mr. Rick Barassa. We have one person that can't make it today, Dr. Brad Thorpe. He's doing important work at the hospital. Welcome to the branch manager of the John Howard Society, Mrs. Jody Oakes. Welcome to the program coordinator of Families for Change, Mr. Mike Bachu. And welcome to the director of the Moose Jaw branch of the Canadian Mental Health Association, Mr. David Coulombe. So welcome to all dignitaries, welcome to the members of the media. Thank you to everyone for being here. I wanted to talk to you today about something that's kind of important to me. On July 8th of 2000, I led the eulogy for my brother who passed away from addiction. So it's been 22 years and 6 days since my first brother passed away from addictions. And then approximately 2 years after that, my other brother passed away from addictions. So, but they were both completely different brothers. My first brother was the stereotypical, if that's the right word, person that was homeless for most of his life, on social assistance most of his life, went to jail once for stealing a car to support his addictions, and died one day in a really complicated way. My other brother, though, was completely opposite. My brother was an academic, he was an engineer, highly respected, but he had an addiction in secret that no one other than maybe myself and one or two friends knew about. And he just died in his apartment one day. So I lost one brother 22 years ago and another brother 20 years ago. As I put in the press briefing, the number of deaths associated with drugs and the number of deaths associated with alcohol and other forms of dependency are increasing by about 100% per year. And it's my humble opinion that if any number gets about 100% worse per year, we need to consider doing things differently. So the center is intending to do things about 30 things differently. And of course, I'm not going to go over all 30, but one is just the pure philosophy of the program. Most people that run mental health and addictions programs are actually starting something started by Dr. Freud over 100 years ago. And Freud is remembered by something for another reason. But he started something that's called etiology, or cause and effect treatment, that you have to address the past in order to change your behavior today. And that makes sense, it's evidence-based, but not everyone can get past their previous difficulties. Not everyone can move on. So his contemporary at that time, about 100 years ago, was a guy called Dr. Alfred Adler. And he had a completely different philosophy. Originally, they started their own psychiatric association together. But after 10 years, Dr. Adler said, well, we need a new way of doing work. So we can't do the Freudian etiology anymore. So he wanted to do something that was called Alfred Adler's individual psychology or teleology. So this program will be doing that. Every other program in Saskatchewan, Western Canada that I know of is following this Freudian-based etiology. But I know from my own personal experiences, my brothers couldn't move on from what happened to them as children. And my brothers couldn't move on from what was happening to them in the present. So whether it's through academic reading for myself or clinical readings, but watching it firsthand, I thought, why don't we try something completely different and say, let's just move on today. And the role of healthcare is to help you change today and support you to make changes tomorrow, instead of talking about the past over and over and over again. And it didn't work for my brothers. I don't think it's working for many people. I'm not going to go through all 3 changes, but I will mention the second big change is all of our care is going to be individual based. Individual discussion, individual care, individual treatment. I have a theory that a lot of people are like my second brother, who's a professional engineer, and he was embarrassed. And he didn't want anyone to know that he had a mental health problem. He didn't want anyone to know that he had an addiction. And in my opinion, there's a lot of doctors that feel the same way, a lot of nurses, healthcare providers, police officers, lawyers, accountants, judges, teachers, social workers. And they can't go to programs, whether it's 12-step programs or even residential programs, because the central component of all these programs is group-based care. So group discussion and group-based treatment, and that's great. If that's for you, no one would ever say to quit doing what you're doing. But what happens if you don't want everyone to know your secrets, right? And there's nothing wrong with not wanting to share those secrets. If you're the victim of sexual abuse or physical abuse, or there's something complicated going on in your life and you don't want to share that to anyone other than a healthcare provider, I think there should be a place that you can go to. And I watched my own brother suffer in silence with that because he felt there was nowhere that he could go because he didn't want his secrets known and he didn't want his secrets exposed. So he couldn't even talk to family members about it. Now, I would hope we could talk about it, but if someone feels that they can't go somewhere, they need a place to go, and this place will be a place for that. It'll be a place for a police officer or a firefighter or an EMS worker, a politician, a lawyer, whoever. Anyone that's just even private or secret, that they want to keep everything individualized and confidential, this will be a place for them to go. So the first speaker that I'll ask to come up will be the Moose Jaw Lake Centre Member of Parliament, the Honourable Mr. Fraser Tomey.
Thank you, Dr. Lemstra, for your touching story, and good afternoon, everybody. I want to thank you for inviting me here today, and I'd like to acknowledge not only that we're on Treaty 4 territory, but traditional homelands of the Métis, but also to acknowledge some of the distinguished guests here, and MLA Greg Lawrence, Mayor Tolley, and the Chief of Police, Chief Barassa. Addiction is an illness that impacts millions of Canadians and their loved ones every day, and has impacted people I love as well. And Dr. Lemstra, what you were saying about embarrassment and shame, that can be an obstacle for people to come over. And sometimes with embarrassment and shame, people try and hide that, and they're embarrassed. They don't want to share that. And that not only comes with the victim, but also some of the members of the family. And I would say that probably happened in my life, in my family, with my cousin, who at a very early age started with alcohol, then moved on to marijuana, and then got into harder drugs such as cocaine to feed his addiction, and then eventually ended up drinking Lysol cans. He was taken far too soon. And he was someone that I loved, someone that I looked up to, and someone that I miss. So today it really is an honor to be able to stand here and look at what you want to do. We must do what we can to avoid more tragedies and give people back control of their lives. So I'm very happy to be here today. As you all know well, COVID-19 has made things worse for those struggling with addictions and their loved ones not better. We have lost many good lives, good people over the past 2 years, and overdose rates have tragically exploded. We can do what we can, and we must do more to support those battling with addiction and loved ones before it's too late. Every human life has value, and everybody deserves redemption. This facility will not eliminate addictions in this community by itself, but it is an important step in the right direction. We need to do what we can to make sure that when somebody who is struggling is ready to get help, that the resources are available for them to do so. That means new beds and new facilities like this one. And I'd like to go off script again here, Dr. Lemstra. We live in an industrialized society where everything is cookie cutter. And so to hear what your approach is very refreshing, because we are all individuals and we all have different needs. And so to be able to address those individual needs, it takes time, it takes effort, and it takes patience. And I believe that's what you're going to be providing for people that are in need. And so with that, I don't need to read anymore. I just need to say that I'm very proud to be here. I'm very proud to be part of this, and I look forward to being able to partner with you and to be able to help people that are really in need. Thanks very much. God bless.
I will now ask the Moose Jaw Wakama member of the Legislative Assembly to come forth, Mr. Greg Lawrence.
I too have speaking notes, and I'm probably going to go a little off script as well. But I want to say good afternoon, everyone. Acknowledge Fraser, Rick, and our mayor. It's good to see you. Our folks that work in mental health, my neighbor across the street. It is a good day today, and it is my honor to bring greetings today on behalf of Premier Scott Moe and Everett Hindley, the Minister of Mental Health and Addictions, and your government of Saskatchewan. Let me begin by recognizing the work that you do at Alliance Health and the vital role you play as one of the members of Saskatchewan's healthcare team. Come on, Ollie. For many years, you've delivered high-quality care to the people of this province, and I've used some of your services before with some of the programs that are out of the box. With multidisciplinary medical clinics here in Moose Jaw, Regina, Saskatoon, and Yorkton, by opening this new inpatient center here in our city, you've expanded mental health and addiction services, providing a place where people will feel cared for, supported, and equipped to build a better future. Delivering high-quality mental health and addiction care is also important to our government. In this spring, we added a record $470 million to help mental health and addiction services and supports. This is the largest investment in our province's history for mental health and addiction supports. We're very aware of the issues that are across Saskatchewan, and it's not just here in our cities. It's in our small towns. It's in our villages. It's on our farms. It is unfortunately all over the place. And as one who has come to terms with suffering with anxiety and depression, and to the point I've got service dogs, and the toughest thing it is to do is get help, especially when you're in a position right in front of everybody. So that was one of the biggest steps I took, was phoning to get help. So some of the targeted investments are adding 150 to 200 new addictions treatment spaces across Saskatchewan, improving access to detox services to support those additional treatment spaces, expanding mental health capacity in schools to additional schools throughout the province, annual funding to support the virtual Rural Police and Crisis Team Partnership with the RCMP, and expanding Family Services Saskatchewan, which we just announced in Moose Jaw last week, rapid access counseling program to 8 additional communities in the new funding. And yeah, our city is one of those. Delivering high-quality mental health services is important. Equally important is working hard to reduce the stigma that often surrounds mental health issues. With this in mind, our government, your government, launched a public awareness campaign earlier this year to help address the stigma. The campaign theme, there is help, there is hope, focus on changing the underlying attitudes, behaviors, and beliefs that contribute to that stigma. It is part of a broader effort that includes wellness and suicide prevention messaging. We want to encourage all people to think about, talk about, and take action to maintain their mental wellness and to get help when they need it. We know changing people's attitudes can take a while. Creating public awareness about issues is a significant step in the right direction. To the board and executive and staff of Alliance Health, I truly commend you on your dedication to people living with mental health and addictions challenges and helping to reduce the stigmas around these conditions. And it is a health condition. It's not a choice, it's a health condition. Not only has Alliance Health identified a need in the community, but they've taken the initiative and action for the betterment of our residents and their families. And again, I want to thank you for the opportunity to join you today and hope the best, and let's do some good things.
I will now ask the Moose Jaw Mayor, His Worship, Mr. Clive Tolley, to please come forward.
Well, thank you, Mark. I want to recognize all our official guests, but I also want to recognize, appreciate, and thank everybody who's made the effort to come out here today. I've just recently met Dr. Lemstra on the telephone, and he told me a number of things about his family's struggles, and it made a significant impact on me. And when he suggested that he was going to open a facility here, I was very, very excited. I got all worked up about the fact that we're going to be able to help people. I think I want to talk about 5 reasons, or Clive's 5 reasons for wanting this facility here in the city of Moose Jaw, but by and large, it's about helping people, and that's obviously the first and foremost reason. Secondly, I've been watching this facility as I ride my bike by and wondering what's going on here and can we use this for something, and I'm just tremendously excited about the fact that we've made an adaptive reuse of a great facility for a much needed program. So it's a real good use of this facility. This is going to create jobs and economic development as well, which we can't forget as we continue to try and grow our city. And it's going to bring skilled people to our community, medical professionals, counselors, helpers, different people that are going to be involved in this project, which means, expanding the city, more housing, and all those kinds of things. I can't think of a more beautiful setting than the Waccamaw Valley. Our First Nations people and Métis people came here many, many years ago for rest and relaxation, to kind of refill their food stores and get rested. They used to come here because there was water, there was wood, and there was game. And now we're looking at this beautiful facility, and the gentlemen from Bose have brought over a canoe, kayak, bike, and the people that are going to be getting the treatment here at this facility are going to be able to make use of these kinds of tools as they get healthy and get better. And when you look around this valley, it's a calming, healthful type of environment. And so I can't think that this could be located any better than it currently is. So it's another investment in Moose Jaw for growing Moose Jaw. I'm excited by that, but I'm most excited about what it's going to do for the people. Thank you very much.
I would like to now ask the Moose Jaw Chief of Police to speak, Mr. Rick Barassa, please.
Thank you, Mark, and not only for the opportunity to be here today, but for the conversations that we've had for years around these sorts of issues, and really appreciate it. And I appreciate your innovation and your commitment to making lives better. Recognize all of my colleagues. I thank the Member of Parliament for the land acknowledgement, and appreciate being here with all of us who are so focused on making our community a better place. as I was thinking about today and what this means for our future, and what I was going to say today, a couple thoughts went through my head. One is that we as chiefs of police across the country have been proponents of decriminalization, and you've heard some of the reasons: the stigma, the bias, the negativity that is attached with criminalizing what is a medical issue. But we also are great proponents of decriminalizing with the proper supports in place. And this is another layer of support that is so important to that movement going forward. I'm not going to bore you with stats on crime and on drugs and those sorts of things, but I will tell a bit of a story about what can happen in some of the worst situations. So as a police service, and not just here in our community, but across our province and across our country, we are very often the people to respond to situations involving addictions, involving mental health issues that have risen to the level of crisis. And we do provide responses. They're not always the best responses, but very often what we need to do as policing is take people into protective custody to keep them safe until the crisis is resolved. We also, and this is something people may not know, we also have our doors open 24 hours a day to people who have no place to be safe, particularly in the winter when it's cold, but even on days like today, when people just simply don't have other resources available to them. We welcome them, we bring them in, and we provide care to them. Physical care. We do not have any capacity at all to provide support or aftercare for that. We have great partners in our community that have those in place, but very often they're overwhelmed. And Mark, I thank you for bringing this new level of care, level of support to people who are in the greatest need. And I think it's going to be wonderful. It's a great addition to our community here, and all the best in the future. And anytime you need anything, let me know. Thanks very much.
And now I'll ask the branch manager of the John Howard Society, Mrs. Jody Oakes, to please come forward.
Where's Patty? I just want to acknowledge, that we're on Treaty 4 territory, and the importance of that and this beautiful space that we have up here. This space has been a dream of mine for the last couple years. So I think Pastor Larry, when I showed up here a few weeks ago with Patty, was completely surprised to see us walking through the doors together. I asked Patty up here for a moment it really shows what we can do when partners come together and work together. Patty and I connected. Patty is the COO of Alliance Health. Patty and I connected with me reaching out, trying to find some supports for some of our individuals. And that connection and the work that we all do, as Chief Barassa spoke about, as community partners and working together, reaching out to Patty, we've now spent, our individuals were very well taken care of at Alliance Health, but we've now spent time together. We've now spent time in conversation. Freud and Adler, it's a huge passion of mine. But we've connected. We've spent time in the community. We've spent time at the center. And that's really what this is all about, is all of our partnerships being able to come together and working together. So I can't thank you enough for everything that you've done and the time that you've taken to tour around with me in the community and to come to our office and to chat and to make those connections. So I just want to thank you for that. Thank you. I'm very excited to stand here in this new treatment facility in our community. So I work for the John Howard Society. I'm the manager of justice for all of our programming in Musha. We have different areas of programming. One of the programs that we have in our community is the My Place program. It's the only type of programming that we have in our community at this time. It started in March of 2020. I was the very first caseworker in that program. We started out trying to see what we could do with our homeless population in our community. But we know with homelessness comes mental health, and comes substance use, and comes poverty, and comes food insecurity. and all of the issues and barriers that people face with that. So each day I work with people struggling with mental health and substance use. It's hard for people to access treatment, sometimes without the support of a team, and sometimes even when we're assisting them, the wait becomes too long for someone. It's too hard. The individual sees no hope. And the substance that they use is the only thing that helps them deal with that trauma that they're dealing with today. So they turn back to that substance, and unfortunately, they don't have the opportunity or the chance to get to treatment. So we work with people at the John Howard Society anybody who faces, barriers each day. We work to support them, we advocate for them, we try and give them a sense of hope. So as I stand here today, I think of the people I think of the overdoses that I see in our community, and I just want to share a couple of those. I just want to share a couple stories today. I think of an individual a couple weeks ago who I had to Narcan. They were overdosing. They came to me. They managed to get to our office. They were embarrassed, and I remember them saying to me, "Jody, I'm so embarrassed, but thank you for saving my life." I could save their life in that moment. I could bring them back from their overdose, but it's going to be a place like this that's going to be able to save their life for a long time. It's going to be able to help somebody, and to be able to make those connections and to be able to know that they do have hope. Having staff that will give them hope, having that sense of individual care, which is what so many people miss, is that individual opportunity to have that individual care. I want to share a story today about a young man named Ben. I'm very involved in our International Overdose Awareness Day. I'm a huge advocate of harm reduction, naloxone training, Narcan training. So I chat with lots of people who this is affected, and families, and with Ben's family's permission, I just want to share a little bit about Ben. Ben's family, Ben was from our community, he was from Moose Jaw. Ben's family lost him 2 years ago at the age of 24. If you knew Ben or saw Ben, he was the guy that had the largest smile, the hugest heart. And even though he struggled, and all the struggles he went through, he was always there to try and help somebody else, no matter what. He wanted to be that guy to help. Ben's dad has shared with me in the past that a week ago, before Ben had overdosed, he reached out, but he was unsuccessful in getting into a facility. And a week later, our community lost Ben to this disease. Some of the last texts that I have from Ben, we were planning, it was hot, it was warm, we were planning to go for ice cream, and that unfortunately never happened. We lost Ben before we got to go for ice cream. I'm not sure if Ben would still be here today. I've chatted with Ben's family about this numerous times, and we're not sure if Ben would still be here today. But if this center was here when he needed it, it might have been an option for him. It might have been an option for his family. And for family to be able to come and to break down that stigma and not be embarrassed as family members to say, my son's struggling, we're struggling, we need help. If a facility might have been here, maybe Ben, would still be here today. We can't bring Ben back, but I hope that Ben can see this today. I hope he can see this facility. I hope he can all see us here today. And I know that he would want nothing more than for a center like this for other people to attend. Our community has been so amazing at supporting us, the John Howard Society, and our programs, and our community is so giving in so many ways. We have people reach out every day supporting us and helping us, and we can't thank our community enough for that. With the individuals that we support in our community, we would love for them to be able to access this treatment center. For most of our people, the cost of private treatment, it's far too much for them to incur. We pay for people to try and access treatment in other centers. People can't afford travel. They can't afford, to get there or come back. And when they're there, they don't have the supports. A lot of our people, they don't have family. Sometimes we are their family. Sometimes we're their only support. So they don't have that family. So we would be honored, as John Howard, to have a room sponsored for a client who would be able to benefit from this. We would call it My Place, And with a dessert one night in their stay, their dessert would be ice cream. So Ben could have ice cream one more time. Thank you.
And now I'll ask the program coordinator for Families for Change, Mr. Mike Bashu, to come forward. Mike will explain his own program, but we've asked Families for Change to help us with preparing our meals Monday to Saturday, so 3 meals a day, and also to help provide our cleaning services at night. And Mike will explain his program to you.
Hi, everyone. For those that don't know, I'm with Moose Jaw Families for Change. Our agency provides supports for people with developmental barriers through our residential, community, activity, and employment programs in Moose Jaw here. So the opportunity to provide meal service and the cleaning service to Alliance service recipients will provide more meaningful employment opportunities for those living with varying abilities by learning real-world practical skills in an environment that lets them give back in a meaningful way to the community. This kitchen will be supporting local when buying produce whenever possible, helping to build our local community. With Alliance bringing this extraordinary service to Moose Jaw, will have a tremendous positive impact on all of the lives that it touches. We are extremely grateful for the opportunity to work with Patty, Mark, and the rest of the Alliance Health team, and look forward to being part of the wonderful work that you do. Thank you.
And then I'll just ask the director of the Moose Jaw Branch Canadian Mental Health Association, Mr. David Coulombe, to please come forward.
Well, I am going to try to cut it short because, well, we've been here for a little while, and I'm wearing a black T-shirt. I don't know what. Anyway, greetings to Mr. Tolly, Bourassa, Lawrence, Mr. Tolmy, Jody, pleasure to meet you today, and Mark, I'm definitely going to have to come and meet you there besides just going to the restaurant and eating on a regular basis there. And Mark, thank you for having us here to celebrate with you this important moment. Ladies and gentlemen, on behalf of Canadian Mental Health Association Moose Jaw and CMHA Division and all of CMHA branches in Saskatchewan, I would like to congratulate and thank Alliance Health for the initiative to bring into our community this very much needed new inpatient residential mental health and addiction center. Yeah, thank you. Eh? We're grateful at CMHA that, again, one of our partners in health and mental health services shows vision and readiness to deploy time, energy, and resources to contribute to our efforts of making Moose Jaw a better place to live in. Mark, you were talking about personal experience, and I'm pretty sure that many of us will appreciate that when we're working in this particular field, often enough, that was the initial call, and we certainly are very empathetic to the stories that you have to share with us, and thank you for doing so. We're glad to see that there's going to be a focus on objectives into the future for the clients and patients that will come through here. And definitely this is in line with a lot of our approaches. And in particular, I'm liking to see that there are psychosocial and potentially sportish type of activities that are going to be integrated right away into the programming. We know at CMHA that sure, there's things that can be done, medically speaking and therapeutically speaking, but then again, after that, there's a life to manage, and that life, like we all share, is rounded because there's so many things that come into it. And talking about mental health for all. As you may know, these are the words that we live by at CMHA. And I was pleased and reassured to learn in our recent conversation, Mark, that measures have already been taken to offer accessible care to Saskatchewan residents, or to offer this accessible care to Saskatchewan residents. But most importantly, that you have already made particular considerations for the too many unfortunate patients that cannot afford such essential service. As I understand, options are being put in place to make mental health services available to all, right? And as our friends at Alliance say, when people are ready for care, they need it immediately. Today, we cannot afford to let economic barriers prevent us from helping patients overcome these terrible challenges. And so we offer you a full support in exploring all of the avenues that exist to make our vision, mental health for all, a reality. Finally, as you may appreciate, a long journey awaits fellow citizens that will come through this facility. An important element of their success is the support and help that will be offered to them through the various integrated services accessible in their community. I'm very enthusiastic again about our conversation we've had thus far, and we look forward to collaborating with the entire team here at Alliance. There's hope for communities like ours in respect to mental health and addiction issues. And that hope rests on all community partners doing their part. A little side note to Mr. Tolme, Tolley, and Lawrence. You know, all of our community organizations face challenges when it comes down to showing up because we are constantly challenged by the economic reality that we deal with. But I want to reassure you, Mr. Mark, when our help is needed, we at CMHA will be there. So again, congratulations to Alliance Health and all of our partners. Thank you for the work that you do.
So I'll just quickly wrap it up. Thank you to all the dignitaries for speaking today. Thank you. Thank you to the media, most of which are online. Thank you to the Church of God and Pastor Larry for being our colleague on this initiative and being our landlord. Thank you, Brad from the CIBC. It was your money that paid for this. So thank you for the money, because that matters. I'll end it up on one note. I was just, going through my own past. So I've written a 54-page book. It's very short. Each chapter is 2 pages, and it's coming out in about 3 weeks. And of course, I'll give every dignitary here and everyone in attendance a free book of it. But it's what I've learned I went to university for 33 years. I've worked for 28 years. And I've had some learned experiences. It's my ideas, as best as I could come up with, on how to change the way that we approach mental health and addictions. And it's a step-by-step plan from a society point of view, but also an individual point of view. And it has many workstation pages so that people can actually work through the issues and learn skills while they're doing it. I'll just end it with. I was looking at the eulogy that I wrote for my first brother that passed away, and I found a passage, and it was called "I'm Free." And I'm not going to read the entire passage, but I picked that passage because my brother was really free for the first time when he actually passed away. His last couple of years were very, very, very difficult. And the first sentence of this passage says, "Don't grieve for me, from pain I'm free." And halfway through it, it says, "I could not stay another day." And then it ends, by saying, "God wanted me now, from pain I'm free." So I'm hoping it doesn't have to come to that for future people. If people have people within their community, within their family, within their neighborhood, that we don't have to go through the suffering before the passage. And certainly we don't have to witness another preventable death from a family member or friend or even a work colleague. So at least in some way, this center is for me to make up for not doing enough to help my brothers when they needed it. So thanks to everyone for being here, and I appreciate it.